All right, let's dive into a question that sounds so simple, but is actually, incredibly complex. What does it really mean to be healthy? It turns out the official definition we've been using for decades might actually be holding us back. And today, we're going to explore a powerful new way to think about our own well-being.
So just for a second, what's your gut answer? What does being healthy mean to you? Is it just not being sick? Is it about being able to run a marathon? Or is it about feeling happy? See, it's tricky. And believe it or not, for over 70 years, the entire world has been working off of one official and, well, very ambitious definition.
And this definition, it came about right after World War II, a time of incredible optimism. And it didn't just aim high, it was going for absolute total perfection. This was a revolutionary idea that completely changed how people thought about health.
And here it is, the World Health Organization's definition from way back in 1948. And you got to admit, it's a beautiful thought. For its time, this was huge. It was saying, hey, health isn't just about what you don't have, like a cold or an injury. It's about what you do have, this complete well-being in every single part of your life.
But, that was 1948. The world looks a little different now, doesn't it? Our medicine has evolved, our lives have changed, and some pretty serious cracks have started to show in this once perfect foundation.
And here's the real kicker. It all comes down to one single powerful word: complete. Think about it. If health requires complete well-being, then who is ever actually healthy? I mean, you get a headache, you have a stressful day at work, you have a small argument with a friend, boom. According to this definition, you're efficiently unhealthy. It just doesn't work in the real world.
So this perfectionist ideal creates three big problems. First, it fuels what we call medicalization. It can turn totally normal parts of life, like aging or grief, into medical problems that need fixing. Second, it just completely ignores the reality of chronic disease. Millions of people live full, amazing lives while managing conditions like diabetes or arthritis. But this definition basically says they can never be healthy. And third, it's impossible. How on earth would you even measure complete well-being? You can't.
I mean, just think about how much has changed in the 70-plus years since this was written. Back then, a chronic illness was often a death sentence. Today, people are living longer than ever, managing these conditions for decades. An old definition that labels them as permanently unhealthy isn't just outdated, it can be actively harmful.
Okay, so if the old definition is broken, what do we replace it with? Well, a team of health experts came up with a pretty radical shift in thinking. They asked, what if health isn't some perfect destination you have to reach? What if it's a skill you can build, a dynamic ability to handle what life throws at you? This slide just lays it out so clearly. On the left, you've got the old idea, health as this rigid, static thing, a perfect state you have to achieve. And on the right, you have this new concept, health as a dynamic ability. It's not about being in a perfect state. It's about having the capacity, the resilience to navigate imperfection. And this is the core of it, health as the ability to adapt and to self-manage. It's not some absolute standard that most of us will fail to meet. It's a flexible process, a capacity we all have inside of us. It's a definition that actually includes all of us, recognizing that resilience is at the heart of being human. So what does this actually look like? The really cool thing is, this new idea doesn't just throw away the old framework. It takes those classic domains of health, physical, mental, and social, and it completely reimagines them through this new lens of adaptation. So let's start with physical health. Under this new model, it's not about never getting sick or hurt. Of course not. It's about your body's incredible built-in ability to find its balance again when things get knocked out of whack. There's a scientific name for this. It's called allostasis, and you can just think of it as your body's amazing internal balancing act. When you get a cut, right, your body doesn't just sit there. It jumps into action. It mounts this whole protective response to stop the bleeding, fight off infection, and heal the skin. That capacity to restore balance, that is physical health in action. Okay, so what about mental health? Same idea. It is not about being happy 24/7. It's about having the inner toolkit to make sense of life's inevitable challenges and find your way through them. This ability is called a sense of coherence. It's your capacity, when you're facing a tough time, to see the situation as comprehensible, as in, okay, I can understand what's happening. Manageable, I have what it takes to deal with this. And meaningful, this challenge is worth my effort. It's all about resilience, not about living a stress-free life. And last but not least, social health. This gets redefined from some vague idea of social well-being to something way more concrete and, frankly, more empowering.
Social health becomes the ability to be part of your community, to manage your life, to work, to fulfill your potential, even if you're living with a medical condition. And this leads to this really fascinating idea called the disability paradox. Researchers have found that people with serious illnesses or disabilities often report a very high quality of life. Why? Because they've adapted. They've learned to self-manage and thrive within their circumstances. That is a profound form of health.
So what's the big takeaway here? Why does this all matter? Well, shifting our definition from a static state to a dynamic ability is not just playing with words. It fundamentally changes how we approach healthcare and maybe even more importantly, how we think about our own lives.
And this chart just nails the practical difference. The old definition pushes healthcare to focus on one thing, getting rid of symptoms to chase that impossible, complete state. But the new concept? It shifts the whole focus to empowering patients, giving people the skills and the support they need to adapt, to manage their own health, and to build that resilience for themselves.
At the end of the day, this new idea isn't presented as some final, perfect answer. But as the researchers themselves put it, it's a powerful starting point for a truly fresh 21st century way of thinking about what it means to be human and healthy.
And that really leaves us with a final empowering question to think about. If health is an ability, not a perfect state, doesn't that mean it's something we can all work on and improve, no matter what our circumstances are? It reframes everything, putting the power back in our own hands to define what a healthy life looks like for each of us.